Good afternoon, everyone. Just a quick note. We're just running through the motions, just letting all of the participants come through the lobby, and then we'll start again 12:05. Thank you. Here we go. Good afternoon, everybody. Thanks for just joining the third webinar session for the updates on the engagement portal and some of the progress that's been made in this week. I think I just first, before I start, I just want to take the opportunity also to thank our development team at Novus 3 for the agility and the responsivity in terms of assisting SAHPRA address some of these topics that are flying in at quite a pace. We've made, I think, very good progress this week in tackling some of these issues and getting these bedded down quite rapidly. Also, just a big thanks to the applicants who continue to engage us constructively through the support desk ticketing system, and certainly also via the messages that we've been receiving. I think a lot of good input and feedback has been coming through, and we'll touch on some of those suggestions that has come through the I think improvements, and I think for me that was the positive to start seeing that we are now getting some emails come through around, can we improve this or that, which means that we are at least making some good headway in terms of closing out then problem areas. Because I think, let me then share my screen and just call up the presentation. You'll let me know once you can see it.
Sure.
All right, let me just start. Keep clicking the wrong thing, but hopefully today I'll get it right.
Good to go.
Alrighty. Okay. Great. Right. Think a little bit of a shorter agenda today. So we just want to give some feedback on some of the Q&A main themes, then just provide a general update. So just again, the topics that we've seen coming through the support desk, that we've picked up also in conversation and through emails that have been channeled to us, as well as then in the second part, just the feedback on the activities that we had mapped out for this week, how far we are and where we are, and statuses for those different activities. Also just want to cover some of the Section 21 topics and themes that we've started seeing on the portal support desk query list. And also then just to confirm a very focused date and session for Section 21 webinar, where we'll have a slightly more in-depth deep dive around those particular topics and themes. So let me maybe then just pop through to the next slide. Right, so few questions, thematic areas that have come up from the Q&A. There was a question around just how we would handle legacy submission sequences to onboard those sequences into DocuBridge, as well as then, the feedback back into the portal, so that sequence is there and the sequential number calculation then calculates correctly. So we have been engaging also with the colleagues from DocuBridge that's supporting us, and they are busy preparing that communication so that we can share that as part of the HPA industry communications, expected then Wednesday morning. So we'll have a workaround process for those older sequences that needs to be submitted as ECTDs, but it will be something that we'll need to run parallel to the portal. It will not be processed through the portal. And once it's in DocuBridge, then we still have to do the synchronization of data back to portal. And then that sequence and sequence number should be available. But we'll share the communication then on Wednesday as to what the steps are to be followed. And that process then will also be in play as of Wednesday. There were questions around whether or not the training guides could be downloaded. So please, we just at this point just want to point out those are being revised as we now introduce new content. So it is version controlled, and because they are continuously being revised, this is not something that's in a downloadable format. If you want to have the latest information and access to the latest training tooltips, please then use the online version as it's available. Questions around BE study. So if a application does not have a BE study and there's an exemption, what should you do? So I think the screen at the moment says, is a BE study included? So if it is, the answer is yes. And if it's not there, then don't say yes and skip that field, or mark it as not applicable if you need to fill something in. So it's not a field that's used for validation, because your BE study and your waiver and exemption is still part of your ECTD submission, and that gets evaluated by the technical units within core business. For us, that particular field is what is then used to drive our fee calculation algorithm. And as you know, on the fee gazette, just if a BE study is included, there is a surcharge. And this is to assist us to manage the appropriate costing, so that we have that information up front, and it doesn't come back as a technical screening query later. So the legacy data where updates have been saved with incorrect values, we've seen a few questions and also a few tickets come through the support desk, where there were some of the applications were saved with some data, and the question just around how do we go back now that it's moved from legacy into applications manager, because now the fields are locked. So we would ask, please, that you log a ticket for us. Give us then the detail of what is the application ID and application number that we need to delete for you from the applications manager data table. And that will then push it back down into your legacy applications screen. So it will be available for you to then update with the correct information and then saved. And reason why we cannot alter or edit any of the information is, of course, just from a user log perspective, we do not want the ICT colleagues to have data entry logs on those specific attributes of the products. It needs to be something that is then managed by the organization. So that is why, from a segregation of duty perspective, we just have to follow the process where we reset the information, drop it back down into legacy, and it can then be reprocessed with the correct information. So if you've had a challenge there, just log through the tickets and we'll then manage those as they come through. Questions around planned submission dates for legacy applications. So I did mention on Wednesday, if you have available the original application date as per the old application letter, and it's a known value to you, then please provide that information. Or otherwise, if that information is not available, please use then a default value of 01/01/2000. That field is not something that we necessarily look at for legacy applications. This is more really to assist us with resource planning and workload planning for new applications that come in. So the value that we carry there for legacy applications, if you have it based on the old application letters, populate it. If you don't, just use this default value, because we can then link that through to the legacy application. It's more relevant for new applications. Then another question that we've seen also through portal support, as well as on the Q&A for Wednesday, for legacy applications, a lot of questions around where we have users going directly to legacy data, looking for applications and then struggling to find their applications. Please start your application search by going to that tab that says search application. And do that unless you actually know what your application ID is. You'll see on the legacy data screen, we have application ID details only. And therefore, it is actually an easier route to pick up your legacy applications if you start with the search function. Right. I think we just from legacy data updates, there was quite a few tickets as well as questions around dosage forms. One of the challenges that was raised is if you are now accessing a legacy data application, how do you go about correcting things like, for instance, where this field used to carry a value called tablets, because you cannot click on it, you cannot access it, you cannot change it, you cannot select the drop down. So even with these screens, there's a specific sequence of steps that you need to follow to enable the drop-downs to be activated. So we've done this short little video just to take you through it. I will also ask Cornel to jump in where needs be, but really it is just to follow through all of these one after the other until they become available and they are populated with the correct information. You'll note on the video the example where now once you've updated the route of administration, your drop down for the form is then enabled. So tablets, because that's not actually on the drop down list, you then have to select the specific tablet as per this example: chewable tablet, fizzy tablets, etc., etc. Cornel, shall I maybe pop through
I'm happy to talk
video,
through
or
it.
you? Yeah, sure. Okay, let me just
Yeah.
start the video key here. Hopefully everybody can see it.
Right, so this is a typical example. So that tablets is imported from the legacy data, so that field is there. So as Priscilla mentioned, the ideal process is to start from the top and complete the information. But this is, I think, the confusion that's setting, because it's validated, but now you can't do anything. And there is a relationship between the route of administration. So selecting oral then enables that, and there is there now available actual options that we need from a data integrity point of view, not just tablet, but that is how it was listed in the legacy data. Yeah, that basically covers it. We've seen a few of those coming in.
Yeah. Yeah, so I mean, I think that for any of those fields that you're still having a problem with, just be mindful that these values are values that comes from very old data records. So if there is some, I want to say, nonsensical information like null or dash squiggle swiggle 1 2 3 4, that is what was in that legacy data set, and this is why we are going through this process to say, well, that is actually not a valid value. So if it says null and it should actually be oral, please then go and update that field to oral, because we only have that limited data set from some of the legacy applications. That's how it pulls through, that's how it displays. But this is also why we are asking, please, that you just step through all of these data attributes, so that we can make sure that we now have good, clean, quality data linked to your applications and the different application IDs. Right. So for section 21, we just want to remind all of our section 21 users that have moved from the old section 21 Power Applications app, moving on to the new SAHPRA portal. These are two completely different software platforms. And for you to access Section 21 applications procedure, you need to create your user account. You have to set that up as a new account. We are not able to bring across any of the old data from that old Microsoft Power Apps application system. So start first by making sure that you have created a new account, as the old system's credentials will not work when trying to log on to the new SAHPRA portal. It is just a once-off activity, so once it's set up, you should be good to go. Just a reminder also for the public or government institutions, when you set up your account, to please remember to select the organization type of public health institution, and that enables us to then calculate the correct fee for these applications as it applies to public health institutions. As I've mentioned, we do have quite a lot to cover for the HPA processes, and I've had some contact sessions and engagements with parties around how we can granulate and do a little bit more of a deep dive for Section 21. because there are very specific questions and themes that those colleagues would like us to address. So we will be setting up a focused webinar for Tuesday morning at 11 o'clock. So that we can just engage then on the Section 21 application. So in any of our applicants that's on the call that this applies to you, please just make a mental note that webinar link will be coming through during the course of the weekend, if not very early on Monday. But if you can just put a pin in that one for us for Tuesday at 11. And I think, yeah, we obviously have already got some nice themes and topics to talk through, things that have been coming through from the portal support desk. So a lot of good questions, a lot of good suggestions, and certainly have had very positive engagements. So hopefully, yeah, we can have a good working session also on Tuesday. If there are any interim queries, if you're already set and you've got your account on the go and you have got your applications processes on the go, if you then encounter any issues, kindly do reach out to us still through the support query process. We will be attending through those queries. I think the other positive thing, as I've mentioned, is we've started seeing the number of different themes start to reduce. And it certainly looks like we're starting to get more and more suggestion requests at this point, which is good. But I think once we've had a focus session for Section 21, we likely will then also start seeing some query reduction there. But for now, please do feel free to continue to reach out to us so that we may assist you. Or I think just updates in general. We do note that there are still a few user accounts that being created. A few user accounts where we still have queries saying, well, you know, we've created the account, we can't yet see our data. Please assist. So where there then is a missing data field or something that we need to correct, we will continue to view this as an ongoing process. And as those requests and prompts come through, to then reach out, connect, make sure that we resolve the particular blockage for you. And then your imports will continue to run, and we will be doing those daily during that maintenance window after 4 o'clock every day. So any new account that gets created where legacy imports are now required, or any accounts that is now fixed where we need to do the legacy data imports, we'll continue to run that process with you after 4 o'clock every day. And we can certainly reassess this with everybody on the 22nd of April to get a sense on if everybody has now been accommodated, everybody can see their data, access their data. And if we still have a few challenges, we will run the process then until the 30th of April. So I just wanted to make sure that we also provide that reassurance that there is no firm cutoff, and we do know this is something that is going to take a little bit of time. To the same token, also for updating legacy data, what is important is that legacy data records that you need to have in your application manager view in order for you to submit a variation, for example. Those ones, we understand that the organizations will then target and approach them in terms of updating them first so that they can be elevated and at least your transaction can move through, whilst you and the rest of your organization members then continue to work through the list and update the legacy information. So with that as well, we acknowledge it's an ongoing process, and I think for some applicants, you know, it's obviously a little bit of an easier process. Other applicants, it's a bit of a more longer process due to the number of lines and applications that needs to be updated. So just that context around what you need to transact on urgently, or new transactions you need to create, target those applications then through that search for application, find the specific one you want to clean up and elevate to applications manager, and the rest of them you certainly may process them on an as and when basis. they will only be available for transacting once you've completed those activities. So it's not a process that we will dictate. This is something that you can continue to drive. I do just want to thank all of the colleagues that have started updating these legacy records. Actually, we are very, very happy with the amount of data items that's already moved across. So for the companies that have had a chance to actually get their hands around that, thank you very much for your support. And the reminder just for INN searches. So we have had that functionality since Wednesday, where you can now also create a manual entry for an INN. We've got a short little video. We'll run through that one also now, just to show that workflow again. On this topic, I just have to call out, and I know what it's like, because I'm also, how can I say, a child of the new digital age, where latency is a frustration, and you kind of, when you want to click on a thing, you want it to respond instantaneously. But for INNs, again, just a reminder, it runs through 3 different databases when it does its search. It will take a few seconds. It could take 10 seconds, it could take 15 seconds, it could take 20 seconds. But you will see, once it's completed its search run through those 3 different data sets, it will then return a value that says no results found, or it will then return a value. And if it comes back with a no results found, you will notice on the video now, we have that option there to say, well, okay, we now want to enable the manual entry. So just give it a chance to run through that cycle. As I said, one of the things that we must continue to strive for is that we start taking in the correct information. So ideally, if we can allow it to run each search, if it's got a positive hit, we can pull that in. If not, then yes, the manual entry option is there. And this is also then something, those manual entries over time, that we'll continue to clean, normalize, and then bring into our reference tables. Right, on the same theme or topic, is just for fixed dose combinations, a few questions on the Q&A, and obviously also a few support desk emails. How do you add those individual INNs, and what do you do with the strength? So we've had some discussions around this internally last night, and there's a few more suggestions that we've received also through support desk. So we're just assessing what the best and most practical and pragmatic approach would be to bring in an enhancement. For now, to ensure that we don't have a blocker in your process, we ask, please, that you will continue to add the different INNs on the first screen, where you can add them one after the other, and stick with a sequence where we've got, adding them in alphabetical order. And of course, if there is mixed schedules, to add the higher schedule alphabetical order at first, and then the lower schedules alphabetical order behind that. And that same sequence needs to then follow through onto the second page, where in the proposed proprietary name, we will ask you for now, put in the name, and then within these brackets, just the strength for then the different INNs that you've added on the first page in that exact sequence. We will be doing data normalization once we've deployed the enhancement to then bring those values across and link them to the APIs that you filled in on the first page in that in that sequence. So just, for consistency, please, let's just make sure that, once you've added your INNs and you transfer then the strings into this field, as we then normalize the data, we literally will just take these and say first line, second line, third line. And I think then the next one was just, so there is a mandatory field on that strength screen where you have to put in the strength. Again, the suggestion for now as an interim is not to have a blocker. Just take through the first value and put that into the strength field. As I said, when we run the normalization, we will actually then replace those values and slot them into the right spaces. For variation codes and costing, we will have this available as an Excel table. As we said, we've run through the processes and secured input from the different units internally. And we've consolidated that with some of the support queries that have come through, looking for specific codes. And we have now updated the variations code table. We will, as part of this webinar today, publish the slide presentation, but also then at the same place, drop the Excel table so that you can actually download that and just go through that to see, well, you know, what is currently in the reference tables. These are the codes, these are the descriptions, the types, etc. And if there are any queries or if you spot anything, please let us know. Log us a query so that we can attend to that. And for confirmation, then all of the biological codes have been added based on the comments as well as the inputs from the internal biologicals unit. Also, just a confirmation that miscalculation on the response 1 submission, that fee table update has been completed. So we should, after the webinar, have that available when you submit response 1, that there is no surcharge for that specific sequence. Right, and Cornel, please feel free to jump in, but this is then just the little video that we have for what we spoke about, is like the INN, how to search, and what to do then when there is no search result, and how to just create that manual entry to allow you to proceed with your process and not be a blocker. So I'll start the video.
Yeah. All right, so this is for INNs, API manufacturers. So there's Buckaber, you enter it there, you then do the search. So as Christella mentioned, we do check 3 different databases for the data, so it might take a while. Here you can now select the correct one, and then it pre-populates that data. That data can't be edited. For the manual override, for the scenarios, there I just entered some gibberish data. So this search will take long because it's really trying to find that unique name that I entered there. So while it's searching, and I'll show you now, obviously it's not going to find a record. And then it will allow you to either do 2 things, where you can have a manual override, which will then enable the fields next to it. So here we go, no results found. Enable manual override. There's also entity owned, which you can select. So from here, you can then enter the name. And it's also important that there's no funny characters or things, percentages or brackets or things entered in here. The ideal way to enter this for the validation is lowercase with the INN's name. You can then select the CEP name and enter the CEP number. If it is entity owned for a new chemical entity or whatever the case might be, it does not require the number. So I think, yeah, thanks for all that feedback. I think this speaks to that process to not block you. There were a few people that were blocked on this scenario. So also in the Q&A, there were questions about multiple APIs. So you can see there's API manufacturer that you can just click to add multiples.
Yeah.
Thanks, Christelle. Now back to you. Yeah, I know there was a comment around the CEP numbers, if it's outdated as well.
That's it, yeah.
You can take that. Thanks.
Yeah, thanks, Cornel. So I think one thing that we just also wanted to flag is as we are collecting some of this information, it will then search the CEP, CPQ against the HOOPQ and the EDQM websites. It will bring back the current CEP and CPQ numbers. This is used specifically to also prompt all of us. If you have an old CEP, CPQ, this is to be a reminder that we are expecting that notification to still come through. This is not used for the validation, and it will not be a blocker, but we are pulling that value through because we will be monitoring then these against, what we currently have on system. So it's almost a flag for both our applicants as well as ourselves to advise that there is a change that needs to still be submitted. Then just for the master data, so we wanted to deploy those online forms. However, I think we have had a rethink, obviously just trying to prioritize the development team's time and resources. So we've had a rethink around how we want to manage that. And for the interim, I can also confirm that the number of master data correction requests have started to reduce quite dramatically. And I think now that we have the correction on the ATC class and the pharmacological classifications completed as of yesterday, that also then deals with quite a large chunk. The queries that we've received on indications, route of administration, container closure, those have also been worked through and they have been closed. And I think we will then just continue to take the master data request via the email system for now. And this is just to conserve resources and ensure that they have time to focus on some of the development enhancements instead of us then taking time away and creating these online forms. This will be something that we'll do in future, but for now, if you can just continue to log those portal support queries. And then I think, I just wanted to give also today a special shout out to colleagues from Bayer and Sun Pharma in terms of the very structured suggestions that came through via the portal support desk around legacy data changes for how we capture the master versus duplicate splits. I think the way that feedback was sent through was absolutely great. It really gave us good insight into how we can also think about applying a split within the data tables. So we have, I think from legacy data, again, as I said, we had no line of sight actually as to what was the master, what was the duplicates. We basically had all of the application numbers that sat with an application ID together. And we're very grateful to just have that view in terms of how we can now start segregating that. So that enhancement, we will also be tackling that one next week. And hopefully that's also something that we can release during the course of next week. We'll again do the update just to show you what that looks like and how to navigate that. But by and large, it would typically be, a kind of listing of your application number and just a kind of like I want to say a little toggle box, to indicate whether this is the master or this is the duplicate. So we will be working on that. But for now, we just wanted to also then confirm that this is not currently a blocker for you on your process. So we can split those as soon as we start getting the feedback. For anybody that wants to continue to share the master versus duplicate split, please do so. It would be most helpful to also receive that in a nice structured table so that we can just see, well, these are in column A, these are your master application numbers, and then in column B, these are the ones that's the duplicates, as they then sit under one application ID. So yeah, we can continue to then just receive that information, and as soon as that function becomes available, you'll be able to also just flag those as you go through your application information. And I think I did touch on this, but maybe just to just recapture that. So for any new accounts that are created or for any accounts where we've now tweaked and refined some of the outstanding data fields, please then just let us know by sending us a little request to say we have to ensure that your specific CIPC is included in our daily maintenance run. It just helps us to keep an extra eye out because I mean we will run it daily after 4, but it's always good to ensure that we can go back and then just confirm that the specific ones have also been concluded successfully. Right. Right. And then I think the last bits and pieces on our general update is just around the planned activities for this week, where we are and what we managed to complete. So I think for activities that we had for the 7th to the 9th, we did indicate that organization correction needed to be done Tuesday by 12. But as I said, we have seen that there are different kinds of challenges that are experienced by users and organizations. So this will remain an ongoing process. There is no hard stop for this. We will reassess it with you on the 22nd just to see how everybody's got on. And we are mindful of the fact that new organizations may create accounts in future. So it will be an activity that we monitor. But as I said, as soon as we know somebody's done something or accounts have been updated and you pop us a mail, we'll then just make sure your legacy data is available for you as well. We did complete that initial re-import based on that initial account organization corrections. But this being said, as I've mentioned, there is still some bits and pieces that we are tackling. So this will also remain an ongoing activity for us. And we'll run those daily maintenance imports after 6 o'clock, after 4 o'clock each day. For legacy data, as I've mentioned, please do continue to update the data sets to move them through to Application Manager, but you may prioritize which records you then update at what time, also based on and informed by your own internal resourcing constraints. So we can assess that with you again on the 22nd of April. We'll be also then looking at the reports and seeing how many folks have managed to complete all of their legacy applications and how many of them we still have sitting under legacy applications. And we can then engage further on whether or not we need to keep that going still until the end of the month. Right, for the variations code table, as I said, the code sheet will be then available as part of this presentation deck that will be published on the webinar. Please review, flag any queries that you pick up. If there's anything that is not there that you were expecting to see, do let us know. We have had Pratibha spend a good amount of time this week with the different work streams to make sure that we get all the codes through. And we hope that everything is now accounted for, as well as the codes from the biologicals queries that we've received. I did mention the process on just clearing the master data requests, specifically for these categories, and just encourage the colleagues to continue as they pick up an issue, log us a request, so that we may continue to refine and clean up those reference tables. Right, for yesterday and today, we had new applications open up at 8 o'clock yesterday morning. Variations, we had hoped to have that also available at 8 o'clock this morning. However, we will now defer that to Monday at 8. And I think once we have circulated and published the variations code Excel table, hopefully we can start just getting any relevant questions or topics on that sent through to Portal Support Desk, so that we can ensure that they are rapidly attended to before you start creating your sequences then for variation submissions. Right, for old e-submission applications where you require a baseline to be submitted in the new ECTD format. So these are for the ones that we haven't received that first ECTD baseline yet. I think on Wednesday we mentioned that there is an alternate flow that is being proposed to manage those. What we need in order for us to, from a portal perspective, create an application ID and link the specific application numbers to this application ID in order for you to find that transaction on the portal and then be able to process your baseline 0000 sequence. We would still need you to log that support desk query so that we can receive the CIPC detail, the application type, the submission type, information around what the application numbers were, and then also that split around the different strengths, as well as, what was masters and duplicates. We will then create those on the import sequence. And then once that imports have run, that will then become available for you, and we'll confirm that back via the support desk query system that re-imports have been completed, and that your legacy e-submission is now available for taking in the baseline ECTD submission. Let me just move to the next slide. Yeah, and just the recap. So as I mentioned, just something that came out of the Q&A as well. We've had a question or two also come through the support desk. For the training guides and the manuals at the moment, it's preferable for us to keep them online. As we are now, I mean, there's already a few things, as you've seen, we've created enhancements, and there's a few video content items that we've shared, but we are updating those guidelines so that we can continue to produce and publish the latest information. So as we enhance process and as we then are able to reflect that also in the guidelines, best that we rather refer to the most recent and most up-to-date guideline that is then online. Right, and that brings me to the end of the slide decks. Let me then maybe I just want to stop sharing the screen. Right, and then I can maybe just first move through to the Q&A section. Right. So I think for this morning, I'm going to try and do a wise thing and rather start at the bottom and work my way back up, because I always miss the more recent questions. So just bear with me. Sorry, I'm scrolling very slowly. Okay, I think that's the first one. Right, so I think there's a comment or question from Razia, where you said you've noticed that for your organization, all of your sequences there, but it seems that the next sequence that gets proposed for your specific application is incorrect. Raja, maybe if you can just indicate to me whether or not a support ticket for that one has been shared. It would be very helpful just to see the screenshot so that we can then also have a pointed troubleshooting intervention for that. I don't know if you can maybe just pop that on the chat and just let us know if that has been shared. So your organization and if it has been shared on the support desk, so that we can then just retrieve your query and look at that specific scenario. I'm not sure if anybody else has perhaps also had that. I see there's a few thumbs ups here from other colleagues. Just a request to them as well. If they have sent through the tickets with the screenshots, that's great. We will then be able to pick that up and come back to you for your specific organization. So it looks at the moment, well, I'm assuming these are all from different organizations, so it looks to be about 6 or 7 organizations. Okay, access to the portal help desk. So, colleague, maybe if we could just have a little bit more detail, are we not able to log on? It's screenshot again, just if we are unable to log on, is it because the system account hasn't been verified or because the organization is not linked to the user? We just need a screenshot to understand then the specific scenario facing. I mean, we've got 2 recurring themes at the moment that we're seeing when folks can't log onto the portal. Either the user has not been linked to the organization, or then the account verification was not completed, and as a result, the logon credentials is not recognized. And the quickest and easiest way for us to figure out if it's one or the other is just to receive the screenshot. So if the colleague that logged the comment there, as well as the person that confirmed they're also having this issue, can then just indicate for us whether or not we can have a screenshot of that, that would be most helpful. Even if you want to pop the screenshot in the Q&A, we can still only include one API and one indication. What do we do? What do we do if we have applications with multiple APIs? Sorry, I want to open up. Okay, so I see Cornel has added a comment there. I think for maybe let me make a note for that. I think perhaps what would be useful is for us to just jump onto a 15-minute call with the members that have raised this particular issue, so that we can just step that one through with all of you. So it looks to be about 16 odd people. Okay, that's fine. I will take these names so that we can just set up a quick Teams call with you, run through that, and then just troubleshoot that one as well. Cornel, you'll help me make a say. This is APIs and indications.
Sure. The comment I made there, you can add multiple APIs. That was shown in the video as well.
Yeah.
I know there was a request historically to add multiple indications, which is on the backlog for enhancement.
Yeah.
At this stage, multiple APIs is allowed, multiple indications, something we can address.
Yeah, 100%. Yeah, and that might be something that we can only do once we've got that enhancement through. Well noted. Okay, under search application, under search applications, the data takes over 5 minutes to load. And unfortunately, Alistair, yeah, we obviously have quite a lot of applicants at the moment transacting and working on the system. So I think, again, this is something that we anticipate going forward will reduce the draw on the resources. But I will just encourage everybody, please, to exercise a bit of patience. The process overall is a lot faster than the manual processes that we had before. So I think once we've gone through this initial data take-on and data corrections, we do anticipate that we'll have good response times on the different transactions. Okay, baseline option for HPA applications has been removed. Hence, we cannot submit any baselines. We will enable this again. I think we were confirming that manual workaround process for creating a baseline so that we can create the application ID and link the application numbers to it. But this then primarily for applicants that have not previously submitted an ECTD. So if you have not submitted an ECTD before, what we saw is there was quite a number of new baselines coming in where a new application ID was created, and as a consequence, also an application number that differed from the legacy application. So as those were not existing in the legacy data, we now have had to deploy this manual workaround to facilitate taking in the baseline submissions. So we will only enable that once we've got the correct baseline information, baseline information requests through. For now, we've got the manual process as proposed. Also happy to put out the document that takes you through that again. But it is set out on the slide deck that will be shared now, what information needs to be submitted, where it needs to be sent to. We will then load that on the data tables. And as soon as that has been completed, you are welcome to then log on and submit the baseline. So we will re-enable that. We're just please asking colleagues to do that and use that baseline option only once they've completed the process and received confirmation that the application ID and the different application numbers are now in the processing stream for them. How should we handle products with more than one route of administration? What if it's one route of administration, then it's different products, right? Sorry, I'm not a very technical person. I'm asking Pratibha maybe just to weigh in on that. But I would imagine that for different dosage forms, we have different application numbers. So maybe if you can just give clarity on that a little bit more for the colleague that posted that comment. So maybe just elaborate a little bit.
Sure, I'll elaborate in the chat. Thanks, Christine.
Please do, Pratibha. If we send emails to portal support for missing data to be included, route of administration, how long can we expect to wait? So Kathy, I'm going to say at this point, we are starting to see a reduction in the number of support tickets. So we probably would be able to start hitting the 48-hour turnaround window. And that's what we've always aimed for. As I've mentioned at the start of the week, because we were severely inundated with user account creation issues, missing data issues, mismatched data issues, we have been largely focusing on unblocking those pain points to enable all colleagues to access the system, their data, and be in a position to transact. So these requests where this particular blocker is now coming up, we have somebody that is working on that, and we're very happy with the progress also made on those requests yesterday evening before we shut down for the day. That mailbox was cleared. And we continue to expect new things come in as people transact, and we will continue to attend to them, and we should start seeing that 48-hour turnaround window. Applications that were completed have moved to the applications manager, but still not contain details as completed. The proprietary name on the application says, so I think this one again, as I said, if something has been saved and it's not complete or it's incorrect or accidentally saved, please log the ticket through to the support desk. We're going to have to delete the transaction and it will need to then just be recaptured under the legacy tab, please. Okay, yeah, so I think for the colleague, how do we handle resubmission ECTD for e-submissions for variations as we now need to respond? Let me just refer you to the 3.1 guideline in terms of how to proceed with that. You have to type in a SMF number about 2 times before it recognizes this. Again, colleagues, please do just exercise a little bit of patience in terms of the latency that we're experiencing at the moment. This will improve. We are just seeing a lot of users transacting all at the same time at the moment. So it may be a little bit slow before it then accepts the value. So yeah, our sincere apologies for that, but overall, we do anticipate that the process in the end will run a lot faster than the old manual way. Right. Application number changed when completing overview. Yeah, and I think to the colleague that posted that question, submitted with a baseline with new application numbers. This is exactly why we disabled the baseline option. Because that information did not exist in the legacy tables at all, we now have to follow this manual process where we first have to get your request, load that data entry for you on the table, and then you will be able to submit your baseline. So please work with us so that we can follow that process and get your information with the correct details into the system. Okay, I think there's a question for a master with its duplicates. The proprietary name shows as the name of the lowest strength across all of the application numbers, which is incorrect. Should we log this? So I'm not sure if that sits still on legacy application or if it's already in the application manager view. If you could maybe confirm that. Just share with us kindly a screenshot. And yes, indeed, please do log a support request for this. But share with us, please, then the screenshot so that we can understand if it's moved like that into the application manager view. We will then be able to, for the duplicate, just delete the entries, push them back down into legacy, and just allow you an opportunity to then capture the correct proprietary name for the duplicate. Right, so I think just as a confirmation for the ATC classes, we had ATC class at ATC level 5. That was previously displayed in the drop-down list. We've received the input to just correct that to display the ATC level 2, which we've done. So that is available now, and it will be looking for and expecting values for ATC level 2. Pharmacological indications, actions, the SAHPRA pharmacological indications as per the regulations. We have redone that data table last night. That is also now corrected and should be displaying then the pharmacological indications as per the regulations. If there is any queries around any of the values in the pharmacological classification, which is for us just under the current regulations more pertinent, please then do let us know just by popping through a master data support request. But yeah, we have compared that against the Gazette last night, so we're fairly confident all is in order and all is available. What if you cannot find your dosage form? I am not sure if that's a master data query. So if that is a request for us to add additional master data to the reference table, then we'd be happy to receive those requests as well through the support desk, or just add it to the reference table. Okay. We are unable to edit product strength to 5 milligram per 5 milligram for products with multiple APIs. Okay, so I think I have in my presentation explained just what we are proposing for multiple APIs and how to capture that until we have the enhancement deployed. So I would please ask that we then just follow that process as outlined. We will then, as we are normalizing data, take the values that was added to the proprietary name field. Oh my word, my computer wants to restart, sorry. Oh crud. Intercourse, it might kick me out in 4 minutes. So if I disappear, colleagues, please just know it's not me, it's Windows. Oh no, oh no. Okay, I will try and rejoin somehow on my phone. But let me then try and talk a little bit faster just in case I get kicked off. For legacy application manufacturing site, oh no, stop it. The manufacturing site information dropdown only contains limited sites. In our case, none of the is applicable to the product. Again, please, any master data requests, log a ticket, let us have the details, let us update the reference table so that it doesn't become a blocker for you, and the values are there that you're expecting to see, and you can select them and process them and move through with your application. Right, I think that's same theme. Okay, for I think these comments around user account access, confirmation emails, etc. I will also work through these specific questions now with the team after the webinar, so that we can just have a look at your user account and your organization's accesses, and if there is for some reason a blockage for you to receive your confirmation emails or your verification emails in order for you to do your verification and carry on. Right. Okay, so I think the common themes. Right, I'm just trying to see if there's something that is now a different theme. Right, so again, just any master data values that you're expecting to see in any of the drop-downs, you just then log that master data request forms so that we can process those. I think we did indicate originally that we were expecting some master data requests to come through, as these legacy data sets needs to be cleaned and aligned and normalized with current data. Right. Okay, so we've got, I see, Cornel, I don't know that I'm picking up a few more requests from people here, master data related. So I think we can expect these to come through to the portal support desk, hopefully, so that we can then attend to them. We'll just sensitize support desk to that. Okay. All right, and I think, yeah, I mean, for variations, just that comment to reconfirm, that'll be Monday at 8 o'clock. Okay, and there's a question here just on a user permission that we can come back to and just connect with a colleague on that. Okay. And then I think, yeah, I mean, for the as I said, for those baselines that were dropped originally where we had system values assigned to application numbers, if you have any of those still sitting in your application number, your application manager view, please just let us have that detail. That entry needs to be taken off, and we need to create for you your application ID with the correct legacy application numbers for those eSubs, in order for you to then bring in the ECTD. So the values that should be in the envelope for the ECTD should be your original application numbers, and just the correct application ID. So I think for Rudy, we will just engage with you and have contact with you on this, so that we can sort out this particular issue for you. There is, seems, other colleagues as well. I've seen Rudy's email in the support desk. I'm not sure if I've picked up these other colleagues, if I can maybe just ask them to also send me their support tickets. Then we can revert back to them also individually. Okay. Okay. Thanks. All right. So I think the scoping and that enhancement then that we spoke to for strengths, and then the fix those combination indications, that I think as we are regrouping with the development team later this afternoon, we'll also start just pinning down some level of effort estimations and then delivery times, so that we can come back next week and also then provide the update for what the next activities are and also what the schedule is to try and get those ones through. Right. I think there's a request here, maybe just to share what a template should look like if we want to receive that split for masters and duplicates. I think that's really good suggestion. I'm happy to also do something quickly and also share that with the communications unit. So when we publish the slide deck and the recording, as well as then the variations table, we can certainly then share with you the table for doing the master versus duplicate split as well. I've made a note of that. Thank you very much for that suggestion. It's a good suggestion. We wanted to show you guys what those two applicant companies did, but of course, yeah, didn't want to necessarily get into trouble by sharing any information we shouldn't. So I think doing the template actually is the best way to do that. So yeah, brain is a bit fuzzy, but appreciate the suggestion. That actually is a very, very good tip that we can deploy. Right. So I think master data, anything that's missing, anything that's incorrect, anything that should say apple and not orange, even though the number is 1, 2, 3, 4, please let us know so that we can do the corrections on those legacy lists. And then there's a question for section 21. So for the section 21 colleagues, there's been some engagements around the setup of the organizational accounts. That account detail or that structure detail around how we then would advise organizations and their individual sites or practices to set up their accounts, how we advise individual healthcare practitioners to set up their accounts. We will go through that in a lot more detail on Tuesday's webinar. And I think also at that point, we'll be able to give some feedback in terms of how those fee calculations then run for those different application types, being named patient and multiple application, considering some of the input that we've had around different scenarios that is to be considered under multiple applications. And that I just want to also then confirm is at the moment being discussed internally. So we should also be able to then give that clarity and that feedback after we've had some positive and constructive engagements on this quite early next week. If not Monday, then definitely Tuesday during the webinar. Will we be able to generate application ID and application number from 14 April? Will we be able to submit new dossiers on portal? So yes, new application activity is enabled from Thursday morning at 8. Yes, if you have an account and your account is correct, complete, and all the information is there, we should have you able to then apply for a new application already. Please let us know if you have a problem to access that particular option. Then we can have a contact session with you on that. Right, so this is maybe a good question. So will SAHPRA allow additional time for submission following payment now that we are unable to upload during this period as cutoff time is 14 days? Yes, this is also something that came up in the focus group testing session with some of our applicants. Just that the processing within the corporate structure sometimes exceeds that 14 days. And it's not always possible to meet the 14 days. The HPA team have been requested to update the guideline. And I think the suggestion at this point is that it gets, we will monitor this and have the window extended to basically a month. So it becomes 28 days. And that's just to allow all of the corporate processing procedures to be followed. And certainly it's not something that is, as I said, on Monday, we are going to be difficult around the situation that we are currently in. If there needs to be flex on some of these things, there will be flex, because the main idea and the intention of this is to improve the workflows and the systems and not cause issues and hassles. It is just unfortunately this very challenging, turbulent time that we are going through. But as I said, we're already starting to see some improvement in terms of transacting, users being able to ship through their new applications. We've had a few of those actually go through. I think I might have mentioned this on Monday. And those ones are being processed within DocuBridge, and we've already seen status updates come back into the portal for those that have passed admin screening and are being allocated now for technical screening. So with that, there is flex and there is no rigidity at the moment around enforcing that 14 days. In fact, that 14 days from the understanding around your operational requirements, we will be looking at that in any event. We need to include a proof of payment for renewal submitted in Jan 2025 as part of renewal admin screening query. So Frans, I think Pratibha and Ntombi, who's looking after the renewals process, have been asked to just reach out to the specific applicants that have got legacy renewal applications in that was submitted in the old manual process and did not come in through the portal as of 1 April. So I think if I can ask you maybe also just to connect, Pratibha, if you can just connect in the relevant colleagues with the individual applicants for renewal submissions, those legacy ones, so that we can also just advise them what process to follow to ensure that they don't sit with the unnecessary transaction on the system when actually those ones need to be run down as part of old process. Okay. Sorry, I'm not sure. What is the process for variations receiving quality approval that used to require an addendum that used to follow the DVT process, e.g. additional FPI if manufacturing site received prior to portal go live? I would ask please for maybe just an email on that. I'm sorry, the context of this is a little bit lost on me. So if we could just get a little bit more detail through an email, perhaps, colleague, what exactly clarity we're looking for, that would be most helpful. Then at least we can respond to that. I see there's seems to be a few colleagues that have indicated they seem to be having a similar problem. So if any of you could just granulate that a little bit more, we'll be happy to receive the query. Okay, and that kind of has gotten me to the top of the list. Right, colleagues, so I see that I do have, I think, hopefully a few more minutes. My my system restart will allow me. So if I can maybe then just take try and take the hands that has been raised, and we can just try and see for these 6 parties, just to get then, if it's not something that's already been asked and answered, if we can then just take those questions. And Tukoza, if you would assist me just to enable, I think our first participant is Hilda. We can just take that question or comment. Colleagues, I'm just taking those 6 for now, please.
Hi, can you hear me?
Yes, ma'am.
Okay. My question is, and forgive me if it's been changed in the manual and I haven't picked it up yet. Previously, there was a question around grouped variations. So there was a process in the manual for the portal process that if you have a grouped variation, you have to go through an approval process, which is to be described in some or other guideline.
Yes,
and you
yes.
need to get an approval number before you can submit that grouped variation. And so I need clarity on that because I have to do a variation for a biological with 4 type 2 variations linked with a type 1A variation, and it's all the same change. But I have no clue who to address the application for the approval to.
Yeah. So Hilda, I think one of the things that the internal units are busy is to streamline one consolidated variations guideline. So basically one guideline that brings in all of the four different units requirements and specifications under a general guideline. And part of that also is to describe the process that they are looking to implement going forward. So that will be, I think, probably in Q2 or our financial year Q2 that they're aiming to achieve this. So what we have at the moment is just build the system mechanisms to facilitate this process moving forward. But at the moment, there is no blocker in terms of submitting your group variation. So when we enable variations on Monday, and also when you have a look at the Excel table, probably during the course of the afternoon, you'll see that there's a specific code for group variations that can be used. And then within selecting that group variations code, you're able to then bring in your different variations changes, and that gets then facilitated through the portal. So we haven't activated that process or that option on the menu to then go through the route of getting an approval number. At the moment, it's just a field that you can mark as not applicable. And I think when we have that guideline finalized and they've completed their thought process around that, that is then something we'll revisit. But it's not a process blocker for you at the moment.
Okay,
So
thank you.
if on Monday you get stuck somewhere, just let me know.
Okay, thank you very much.
If I
And
can
Kat-
add, sorry, Hilda, if I can add to that. So Priscilla, we completely removed that field. How it
you
will
did,
work
you
in the
did.
future is, depending on the guideline, how you apply for that, there will be a set number. So once the approval number is loaded on the system by the whoever approves it on SAHPRA's side, there will be a drop down of that approved numbers for you to select as you go through your group variations, but it's been removed completely now. So group variation, as per normal, select your codes and proceed.
Thank you. Can I be so bold as to ask another question?
Yeah, go for it.
Thank you. I must say I'm trying very hard to complete the legacy information. And I think I've seen it in the chat. A lot of people are experiencing a similar thing to me, where you can find the SAHPRA site master file number and select it, but then the actual name of the site doesn't populate in the middle field. And then I go and I complete all the information and I select save changes, and then all of the information I've entered is completely deleted again. So it's very.
Can you just give me an SMF number if you've got something on hand, just so that we can look at that. We might want to.
Yes, I can actually give you the number.
Yes,
it
please.
was I0009.
I0009. I think what we'll do is let us get quick Team sessions. I mean, it could take 10 minutes, all of 10 minutes, just get online with you and just see what you're looking at. I think quick probably thought that jumps to mind is we've had a few. It sounds familiar. It sounds like some of the support desk queries we've received where the browser, I think the browser type that was used was Microsoft Edge, not Google Chrome. I'm not sure which browser type you're using when you're opening the portal screen, and if that may be causing the issues.
We do use Edge. Unfortunately, our company does not allow us to use Google. It's disabled. So we have to use Edge.
And unfortunately, our application only runs on Edge.
You mean on
Google Chrome. Yeah.
Okay, so you think it's a browser issue then?
I do think it's a browser issue, but let's jump online with you and just confirm if the suspicion is correct then.
Okay, good. Thank you very much.
Okay, pleasure. We'll be in touch.
Thank you.
sorry, and then the next one to enable for us to cause is Monet.
Good afternoon, Mrs. Reinecker. Thank you again for this engagement. Also, we have been talking about our organizational setup, as you know. I would just like to ask your best advice for this interim period. If we, I know you now mentioned the Section 1 session that we will have on Tuesday. If I sit with a critical patient in one of our facilities, what would the best advice be to lock that particular ticket? Because, administrative is one thing, but I have a real patient at the end. Advice to our doctors, please.
If they have their individual accounts set up on the portal, Monil, they are still able to apply for named patient applications without any blockages. There are indeed quite a few of those that we have received and have been receiving, and they have moved through to the Section 21 unit for processing and approval. So that is still available, and those kind of applications for specific patients can still be submitted through the healthcare practitioner practices.
Thank you so much.
Yeah, so I think on that scenario, we also notice some specific scenarios. So if there's really urgency, that's something I'm happy to, you can escalate to us on to assist in any way as well, probably via Shamli, but happy to assist in those cases directly.
Perhaps any specific category that we can use in our mail subject line for you, Cornel?
CAPS urgent S21, then we'll know.
Okay, urgent S21, 100%.
Yeah.
Thank you so much.
Thanks. So Pratibha,
Thank
if you
you.
can then look out for those and just pass them on to us, then we'll see how we can jump in there to unblock anything.
Thank you.
Thanks.
Thank you. Tukozo, then next colleague, please, Salome. Oh, no.
Hello. Can you hear me?
Yes, we can.
Okay.
Just quickly before you go, Salome, I just want to, Cornel, I see I'm gonna get kicked off now. I'm gonna try and rejoin with my mobile device. So just bear with me for, oh, there we go.
Can I go or
Salome,
should I wait?
depends on your question, but if it's
Okay,
SAHPRA to
so
answer or technically,
Let me
go.
go. So I think there is a number of other people that have raised this in the chat as well. It's causing me some stress, to be honest. We're trying to update our legacy data and we're having huge issues with the site master file numbers. So we can find them, but it's not populating the name of the site in the middle.
Yeah.
And then when we try and save our data, we can't save anything. We actually haven't been able to save a single legacy application to date because of this issue.
Okay. I know the SAHPRA team is looking at an updated data set of it. I did also notice now when I did that I0009, I can replicate that, and that data field is in fact missing. So I will prioritize it this afternoon to re-import that data set. I'm not sure, Pratibha, if there's anything, or Christian, you're back.
Yeah, I am back. Yeah, so I think that probably is the important question. If we can just get that update from core business, because we're quite dependent on that information coming through. Pratibha, would you mind just giving Cornel and I an ETA on what and when we may expect that to come through from the units for re-import? Happy to receive that offline if you want, or if you have an ETA.
No, Christelna, it has to be an offline discussion.
All right, sure. So let me in the meantime, you know what, can you please let us just have your information so that we at least can bring in those values for you, so that your process can flow whilst we're waiting to get the updated data sets from the units.
Who do I reach out to? Sorry, Christelna.
So we're trying to channel all of the tickets still to support email address. So please send it there. But
okay, I think I've raised it 3 times now. I haven't put all the site master file numbers, but I've given quite a few examples, so you will find it there.
Yeah, but see, the examples helps us to address that example. So what we need is all of the master data that you want us to address. So if you send something through and there is a list of 10, give us the full list of 10, because we then update the reference table and then all 10 is there for you to process. So I think the 1s and 2s that Dean has been working through, those ones we have closed those updates on the table. But if there are others that was not on the email, you know, because it might have just been an example to say this is the problem, those ones have been fixed, but you might still be looking for something else that we haven't seen yet. So just a very specific information of what is missing, and then we'll make sure that we prioritize that. As I said, you know, the intention is to support the process and not block it. So if we get the right information, we can certainly action it.
Okay. Thank you.
Thanks. Then I'm not seeing hands at the moment, Cornel. If you can maybe just call out. I think the last person that was on the list was me, but I don't know who is before me.
Benita,
Okay,
Rajul.
great.
Benita.
Good afternoon.
There we go.
I just want to find out, because my legacy data, I don't have any legacy data, any master data, any data on my dashboard, basically. So I can do very little.
And from which organization are you, Benita?
McLeod's Pharmaceuticals.
Okay, and the user account, you've checked on your user account that all of the information that needs to be there is there.
So
The
all of
IPC
it,
number.
yeah, all of it is there. I can do new applications, but I can't access any legacy data. So I'm not sure. I have raised a few emails. I've sent a few emails, but I haven't had a response yet.
Sure. Are you comfortable to give your CIPC number to me now so that we can just check for you what is sitting?
Can you just give me a minute to just get it?
Sure.
Okay. Okay, can I just send you an email with it?
Yes, please do.
Sure.
And then
Even just with the company name, I can quickly do a check here.
McLeod's, MACLEODS, Pharmaceuticals.
McLeod's Pharmaceuticals. You. Okay, I can see. Let me just check here. You can see your users. Everything's linked. You're on there. Okay, I'll request a specific re-import on that number. When did you register your account, Benita?
In November 2024.
Okay. All right. Okay. I will escalate that now to quickly do an import. It takes about an hour and a half or so to run, and then I will reach out to you as well.
Thank you very much.
Perfect.
Good stuff. And I think then, who was the next person?
Cornel. Just give me a second. Switching between windows here. Next up, Sipandla. Sipandla Twala, you're next. Sipamandla, sorry.
Okay, I think course is just unmuting.
Christelna, this person is unmuted.
Oh my.
And and me, so they must just unmute on their end.
Sipamandla.
Oh, okay. All right. I think maybe whilst we're waiting for him, can we go to me?
Hi. Thank you so much for taking my call. I still have an issue with the legacy data. I have done some of the products to move them from the search applications or the legacy applications to move them to the application manager. But when they appear there, they do not have the details that I've fed in. If I open the application, like I'm requiring to do a response submission, which is urgent, if I open the application, because I know what it is, it looks like the sequence progression can happen. It looks like I can carry on and submit, but my application manager does not list the information that I have put in there. And I have sent some emails to query or to ask for assistance in this one.
Okay. Cornel, sorry. I hope you guys can hear me. Hello?
Yes, we can hear
Yes, we
you.
can.
Okay. Sorry, I don't. It's very difficult on this mobile device. Okay. Me, what we can do is maybe again just get online with you after the session. So there's a few people that we just want to connect with then to see what it is that's causing the problem and what you're seeing, so that we can at least try and identify what the problem is and try and resolve that for you as well. So if you can give us a little bit of time this afternoon, we'll connect with you. I think there's now a few people that we want to try and talk to. I've just made a note. We'll also just send you a Teams link for 15 minutes, just quick check-in.
Yes, please. I would really appreciate that. Thank you very much.
Okay. Right. And then I'm not sure, Cornel, if there are any other hands. I do want us to try and wrap up so that we can start contacting and engaging with some of the people that we need to chat to this afternoon before we go into the development meeting.
Okay.
Is there any other hands?
Is now still 8 hands. I'm not sure how far we progressed down to 6. Christine. And then there's, I think, Christine and Karach.
Yeah.
Maybe.
I think that's probably, just looking at the time, let's take those two, and then I'll ask the rest of the colleagues that's in the queue just to pop the information in the Q&A. So
Christine, you can unmute, or otherwise we can carry on to Karach. Karach, you can go.
Okay, thanks very much. When we're doing the legacy applications, as people have mentioned, when you go to save and something's missing, you lose everything. Would it be possible to have a save draft so that at least all of the information that we can capture at this stage can be saved? And then we can pick up as the bits and pieces, we log a ticket, get that resolved, go back in, and then can capture those last bits of information. Having to complete everything and then get to the end and you can't save is extremely time consuming.
and especially I mean what I'm hearing also is like when you got a request in, to say, well, this master data is missing and you're waiting for that, you don't necessarily want to go back and redo everything.
Yeah.
Yeah.
Yeah, that makes sense.
We did discuss that as the things came in, to rather split it to save as draft and then kind of finalize split that out. Seems like there's consensus and a big need for that with master data issues we're experiencing or lack of that. So let's take that on, and we'll discuss it this afternoon and see how quickly we can potentially get that out as an enhancement, because that's the main process that everyone is busy with. And again, our objective is to start reducing any support elements coming in so that you guys can carry on. So
Yeah.
we're still on our call, but yeah.
Yeah,
Thanks.
Cornelia, I think that's another good one from the colleagues at Bayer. So yeah, let's discuss it.
Thanks very much. And then just another thing on the fixed dose combinations. So the aspect that we can now add in multiple API details is fantastic, but the issue of the drop-down menu for the ATC classification is still not resolved, because you can only still select one INN. So either you would have to have an INN of this and that, or have the option to select multiple selections for that field.
Yeah. So I think for that one as well, just to again kind of anchor us around, the purpose of the ATC. So what we have is we've got I think the feedback shares, I can't remember which slide it was. There's that we will be looking at the enhancements for fixed dose combinations. So there is a strength component that we want to address. As well as then this indications component for the different APIs. But for now, the pharmacological classification is, as per the SAHPRA regulations, that's the more important one for us. As long as that is spot on and that is correct and in line with the regulations. If there is only one ATC selected for now, that doesn't present a blockage, and you should still be able to go through with your process. But it's again, just to stipulate that it is one of the enhancement elements around the FTC that we got, that is on the enhancement list that we discussed and also tabled last night. So that one will get addressed. I think it's just the mechanism of actually deploying that that we need to settle on.
Okay, so if we're just selecting one INN, it'll be fine. We can go back in and request an update at a later date.
Yes, yeah.
Okay.
So we've got the INN on the first screen where you can add those, and if it's for multiple INNs, you can add all 3, 4, whatever. But when you get to the second screen, when you get to that section where you now have to select the ATC, one is okay. But then obviously for that product, whatever the pharmacological classification is as per guideline, that is probably the most important field to populate. The information, again, just, there's a lot of metadata we're collecting to enable reporting and management of the workflows. But yeah, what gets evaluated by the core business unit still remains within your ECTD. I think as long as you're comfortable that you've granulated this adequately in the ECTD, that gets passed off to DocuBridge. That's probably most important.
Okay, thank you very much.
Pleasure.
And then just quickly, I got feedback just for Anita. The reason your data isn't importing, I checked on they're checking the database. The CIPC registration number, I believe that's the SAHPRA number that's in there. It's a lot of zeros and then a lot of ones, which is the same number that you use for STP login detail username. So that is the reason why we have not been able to import your data. So if you can just go into your profile, organization details, and please just update the CIPC number in the field, please.
Okay, will do.
McLeod,
Thank you.
Thanks.
Yeah. Cornelia, I mean, if that gets done this afternoon, then obviously that will rerun a bit later this evening, right?
Yes, correct.
Okay.
We're going to run that daily. So maybe
stuff.
on that, just on that practicality. So anyone that noticed their CIPC numbers, and if they update it, we'll run that daily after 4. And then if you accidentally deleted something, submitted a request, once we've deleted that legacy import will come in back again. So just a technical note on that. So we've got a process. Great.
Thanks.
I think that's it from my side. Thanks.
Yeah, thanks, Cornel. I think also for anybody else that had question, please just stay on, put it on the Q&A so that we can just collect the questions a little bit later this afternoon from the communications unit. I am then just gonna close us off 10 minutes early so that I can just reconvene with the team. And we can prioritize then, I think, maybe some of the outreaches and the contacts that we want to try and get to this afternoon. So at least, yeah. Yes,
If I may, Christel, now there's a few that I saw on the QA, and I'm just going to call out first names here. Dale, Susan, Gabriel, there's a Robert, a few people that wasn't linked to an organization. So how you can check this, if you log into your profile and you go to the organizations tab, if you're the org admin, and it just loads a white screen. We are going to flush out all those users. So just re-register with your correct CIPC number. So if you now go to the portal and you were one of those people that if you go to organizations tab and you can't, it spins. That's the reason for it. It wasn't linked to organization. We suspect it was potentially the file upload size of the documents that were attached. So that process broke, but I mean, resolved a lot of those already. So we are going to we've rectified a lot of those already, but there's still an odd 8 or 9 people. So if you now had an account and you go to login, we are just re-register, please. We'll still respond to some of those individually that they haven't come in, but if you were one of those names that I mentioned now, Tepiso Maku, Dale Peters, there's a few of those. So that's also a bulk fix of the last bit of the registration issues, I believe.
Yeah. Cornel, maybe just one thing, just now that you've mentioned one of those names, I think also if the verification email doesn't come through, it is because the linkage between the user and the org wasn't established.
No, that's
think,
the profile was verified. They logged in, they just can't see the legacy data. And on verification emails, so practically what happens, guys, we see this in the logs, is on the last screen once you register, it says check your inbox for verify. There is a resend verify button. Please don't click it continuously because that just causes an extra snowball effect. The bulk mail sending service that we use is very clever. It does buffer things sometimes to not, if there's, let's say there's 5 colleagues from the same company with the same domain that's being sent. There's limits on receiving mail servers for spam checkers or for blocking or rejecting mail. So it does buffer it sometimes to not, it will come through. If we click on resend, it just causes issues. And then the next step typically users do, they go to forgot password. It's not going to send you a forgot password because your account's not been verified yet. So please just, a lot of those instances. Thanks.
Yeah. So I think maybe if these users that then have challenges still linking up to the organizations, rather than just to recreate the account, Cornel, with the correct information, and then that should all be okay for this afternoon's maintenance window for the imports to come through. So that would be the best guidance that we can provide at this stage, and then we'll flush out these non-linked accounts, right?
Yeah. So we'll clean everything from 4 o'clock. So if Monday morning you can't log in anymore,
at least
it's dangerous to say, but that's if you were one of those names.
Yeah.
Great.
So I think the names that's on that list we'll actually check in with you on Monday if that's still an issue. But if we can get that recreation done,
that's better. Let's send out communication to those odd 8 people so you know. So anyone else that's struggling, if you didn't receive that email, it's not you, it's something different. Thanks.
Yeah. So I'll get the names, Cornel, and then we'll just individually reach out to them. Cool. Great. Great. Thanks, everybody. We'll also just regroup then internally with the colleagues, and we'll communicate just for follow-on sessions for next week. It's a little bit of a shorter week due to the Easter weekend. So we will endeavor to have at least one of these webinars next week, other than the one for Section 21, but one also just for general feedback. And then again, the week after, we'll schedule updates again until we've got most of the pain points resolved. Thanks very much, and we'll chat again soon.